A comprehensive stroke center is certified by an outside body, in our case, the Joint Commission, which is the premier certifying organization, not only for accreditation of all hospitals, but for selective disease states, such as stroke. Comprehensive stroke care means taking care of all patients with stroke, not only those with stroke that is straightforward and maybe patients that can be taken care of in community hospitals, but the most complex patients.
So since 2008, the thrombectomy procedure has changed dramatically. It was the first generation of devices that we were able to go up into the brain and try to retrieve the blood clot. But about 5 years ago or so, there was a new generation of devices that were able to go up into the brain and retrieve the blood clot, and it really changed everything dramatically. It was a huge advance in the field, and these devices are called stent retrievers. So a stent retriever is a metal cage, and unlike a traditional stent, which you detach, the stent retriever remains on a wire that you have control of. So you deploy the stent retriever inside of the blood vessel right in the middle of the blood clot to allow the two to tangle up together. And then after about 5 minutes, then you're able to withdraw the device and remove the blood clot, and it is highly effective.
The window was, in these initial studies, was out to 6 hours. So specifically, if somebody had started their symptoms, they had about 6 hours to get to medical attention and be treated with this procedure, with a thrombectomy. And there were many of us who saw that there were some patients who would benefit beyond that 6 hours. Actually, the window for intervention that patients will benefit from is as far out as 24 hours from when a patient has symptoms of stroke.
And since with stroke, every minute delay costs 2 million brain cells. So it's a gigantic difference. So every minute really matters. So the faster we're able to do the procedure, the better the outcome. So first, you're talking about damage to the brain. So you're able to limit the overall damage to the brain. And the way that translates is people just do better.
And more, we are recognizing locally and nationally, the numbers are showing that it is critical that if you have a stroke, a severe stroke especially, you need to get to a comprehensive stroke center. Even if it means transporting a person a further distance, in many cases, your care will happen more quickly, etc. And that isn't opinion, that's really coming out in the data just in the last 6 months.
You have to have a very large infrastructure of staff in place. You need to have the specialty equipment, like the room that we're sitting in is a hybrid operating room that can be used as a regular operating room, but it also has x-ray equipment that enables us to do this procedure. You need the nursing staff, the radiation technologists, and all the multidisciplinary teams. Not only that, they need to be available 24/7.
It's a very demanding disease state to take care of, not just on my part, but on every one of those members of the team that I mentioned. Very demanding. And the reward is profound, however. And if you look at the outcomes from this procedure, thrombectomies, it has as much of an effect on disease and preventing death and disability as any procedure we do in medicine, if not more. But it is very gratifying to see somebody come back who had a life-threatening problem, a problem that statistically has an 80% chance that they will not survive at 1 year or will be permanently in a nursing home, and they come back and they're well.